Bansang Hospital, another of the Gambia's leading referral hospitals, has over the years carved a niche for itself in the area of health service delivery, particularly in rural Gambia. The provincial hospital, despite challenges, especially in dealing with a teeming number of patients, is poised to serving the health needs of the country's population. Established in 1938 as a protectorate hospital during the colonial era, the facility has become another of the country's referral hospitals, serving communities in the URR, CRR, and even villages in neighboring Senegal, attending to all sorts of diseases and providing effective and efficient health service delivery. With an increase in the number of patients daily, health officers at the hospital foresee a corresponding increase in the number of hospital admissions, which is tipped to be higher than that of the previous year.
The admissions this year compared to last year has also increased, even though this year has not elapsed, because like we know this period is the peak period of malaria, even though last year it has occurred, but we have really registered a high number of admissions, both patients seen at the OPD, mainly because of the malaria.
The hospital management has also outlined critical areas ranging from surgery, maternity and laboratory services, among others, where great progress has been registered. This, according to health officials, has also significantly reduced the number of mortality cases.
In June of 2006, we opened a most magnificent 80-bed children's unit, which is offering separate surgical wards, separate medical. We have malnutrition ward, which at the moment, I have to tell you, every bed is full, and we also have children with malnutrition on the ward. We have play therapy, which is a new concept in this country, and it's a very, very important one.
Over the years, the hospital has witnessed a massive transformation of structures and a state-of-the-art facilities in a bid to improving healthcare delivery in the region, thanks to the support of government and a British philanthropist, Anita Smith.
We have staff retention about 98% staff retention is all because of Anita. And not long ago, a 40-foot container loaded with drugs and other gifts for staff, not second-hand, but these are new materials to motivate staff.
Maternal and infant mortality, according to statistics, have also reduced, with all referral cases accessing ambulance services.
Well, with regards to the referral, one of the places that it has declined drastically was at the maternity unit, where we used to have, in 2012 we had up to 14, but this year we had only 2. We have 2 obstetricians this year in 2013. So you will realize that not many cases from that unit will be referred to Edward Francis Small.
The hospital continues to receive support of medicaments through donors, with the recent construction of an 80-bed pediatric block and an obstetric theater, a VIP suite, staff accommodation, among others. Bansang General Hospital could be a perfect example of the government's commitment to providing health service delivery to the doorsteps of all Gambians. Samuel Ba, GRTS.
For more than 20 days in the wilderness, driving through rough terrain for a water course, 9 adventurers of the scooters in the Sahara have finally arrived at their destination. The team entered Bansang to a rousing welcome, ending a journey that began weeks ago. The team embarked on what many called a rocky adventure of 4,000 miles from the UK to the smiling coast of Africa. The British adventurers were accorded a befitting welcome at the ferry crossing point linking Bansang and Bushtown. A colorful ceremony soon followed, staged in honor of the challengers in appreciation and recognition of their worthwhile contributions to the welfare of the people of the settlement. The partnership began several years ago, thanks to a British lady called Anita Smith, who has become a household name in this region, credited with saving hundreds of lives in this area through her intervention in the hospital, cementing stronger ties between the UK and this local community. At the hospital grounds, their next port of call, the guests had a taste of typical Gambian cultural displays. It could be recalled that the health facility was massively upgraded through their intervention, as they pledged to continue that support. The philanthropists the following day were taken to the hospital's self-support 100-hectare farm in Galamanda village to inspect ongoing works at the farm, which harvested dozens of bags of millet to supplement the hospital's feeding program.
This is amazing on top of the huge workload they have as nursing staff at the hospital. So I think this is an absolutely incredible initiative. And every member of staff, every month, pays 10 Delassie. And I said to the staff, what do you get for giving your 10 Delassie? And they said, the fact that we are helping to feed our patients.
The farm, according to the Chief Executive Officer Bansang Hospital, Baba Jeng, has been a grain basket for the hospital as proceeds from the farm serve as supplementary feeding for patients at the hospital.
The proceeds goes back to the hospital. Last year we have about 29 bags of couche, and that's the same couche that the patients are using up to this year. So all the produce from this farm, it goes to the hospital for us to feed our patients.
We had previously supplied oxen from the Scooters in the Sahara project, but it became apparent that they weren't able to farm the whole area with the oxen. So we always like to have a specific project that I can put to the people that are coming along with me, that this is what we're going to do with the money that is raised. So it was suggested, and they looked into pricing, that we purchased a tractor and trailer for them.
As these and other philanthropists continue to render support to one of the country's major referral hospitals in the URR and CRR, there's a belief that if more investments is done in this and other health facilities, the country's dream for quality and accessible healthcare delivery to the doorsteps of every Gambian will come to fruition. Uminjai, GRTS.
The governor of Central River Region, Gani Toure, who doubles as the board chairperson of Bansang Hospital, has joined the people of Bansang to pay tribute to Anita Smith, the coordinator of Bansang Hospital Appeal, for giving the hospital a significant facelift. Anita Smith, who is widely credited for saving the lives of scores of people in CRR, URR and surrounding villages in Senegal, has greatly transformed Bansang Hospital to a state-of-the-art sick bay, given the number of facilities that are housed in the hospital to attend to the needs of the community and its surroundings.
Every year, you will be decorated by the president, because we know what you are doing for this country, what you are doing for this region. And you are not doing it only for Sahara, as rightly said by all. This hospital is serving almost, you can say, 65% of the country.
The Briton made her first visit to the smiling coast of Africa 2 decades ago as a tourist and began her long-standing relations with the people of Bansang.
I came out like many British tourists on holiday. A holiday that I didn't know was going to change my life, that of my family and my friends forever.
Since then, the one-time tourist turned philanthropist continues to raise funds for the hospital and was able to install numerous life-saving facilities which helped transform the health facility into a model hospital.
So we now have the most magnificent children's ward, I'm sure, as a government hospital, not only for the Gambia, but for sub-Saharan Africa. We have separate medical, surgical, neonatal, malnutrition, and something that we all take for granted, play therapy.
Her intervention has changed the face of the hospital and provided the center with proper medical equipment, and in the process providing quality health care to a catchment area desperately in need of such high-quality health facilities. Modu Bajan, GRTS. As the presence of blood at the theater continues to be a necessity for the treatment of surgical and maternal cases, the need for public support through voluntary blood donation becomes even more critical. It is for this reason that members of the Central River Region Blood Donation Society mobilize scores of volunteers within the region to donate pints of blood for use at the Bansang Hospital. The life-saving action is a continuous activity by the youths of the region in a bid to providing the required quantity of blood to those under operations and pregnant women.
This is just incredible. No money can buy good health, and the blood, particularly now, you know, in the malaria season. I mean, there's been 80+ patients every single day, and nearly all of those cases need blood transfusions. This is life-saving.
The day-long activity, which saw a huge turnout of blood donors, saw their efforts reaped 60 pints of blood for the hospital's blood bank.
Several people turned out, and I'm very much happy, and then we received several piles from them. Definitely, I'm very much glad with the turnout.
Things like this, I think, one should not just, neglect it. We should give it out, and we should come out with large number and give our blood.
Recent figures released by the hospital's administration show an 80% increase in severe hernia cases among pregnant women visiting the hospital, requiring an enormous presence of blood at the theater to deal with such cases. The move by the group of volunteers is lauded by the hospital officials, who believe the gesture will facilitate the work of surgeons at the health facility.
This is a very positive move, because you will never move in anywhere in the world where you will see a shop that sells blood. So you only get fresh blood from people to give to other patients. So if people are coming out to support it in that endeavor, I think it's very encouraging.
With increasing number of patients visiting the hospital for surgery, this brave move by these youths will help facilitate the work of the doctors. Modu Bajan, GRTS News.